So next we will be discussing glands. Under this heading we will be discussing sweat glands and sebaceous glands. So let us first discuss sweat glands. These sweat glands can be eccrine or apocrine sweat glands. These are few differentiating features between them. Like the first one is duct opens. So if you look at the duct of eccrine sweat gland, you will find that the duct of eccrine sweat gland opens directly over the skin, while apocrine opens along with hair follicle. If we talk about the nerve innervations, you will find that eccrine sweat glands are under cholinergic control while apocrine is under adrenergic control. If you look at the sites, you will find that eccrine sweat glands are almost present everywhere. These are the common sweat glands, while apocrine are mainly present over axilla, areola, groin. I don't know whether you have noticed or not, but apocrine starts with A. So everything here starts with A. So all these points are so simple to remember. Okay, so apocrine, duct open along with hair follicle. These are under adrenergic control, mainly present over axilla, areola, also groin. And eccrine, you can see C comes twice. So C, it is under cholinergic control. Starts with E, present everywhere. What comes in between C and E? D, directly opens. Okay, so all these points are very simple to remember. You can easily remember them. Fourth is disorders. So there are certain disorders of eccrine and apocrine sweat glands. Like disorders of eccrine sweat glands are anhidrosis, hyperhidrosis, and malaria, while disorders of apocrine are bromhidrosis, chromhidrosis, and Fox-Fordyce disease. Now if you look at the first four disorders, two on either sides, they are very obvious from the name itself, isn't it? N means absence, hydrosis means sweating. So if there is absence of sweating, it is anhidrosis. Hyper means excessive, so if there is excessive sweating, it is hyperhidrosis. Brom means foul smelling, so if there is foul smelling sweating, then it is bromhidrosis. And chrome means color, so if it is colored sweating, it is chromhidrosis. Okay, now this bromhidrosis can be due to both, that is apocrine as well as eccrine. Okay, so bromhidrosis can occur due to involvement of both apocrine and eccrine sweat glands, but mainly it is due to apocrine. So if both are given in options separately, then you can choose apocrine, but if it is asked in PGI, you can choose both. Now these two, that is malaria and Fox-Fordyce disease, both occur due to blockage of duct. So remember, if there is blockage in the duct of eccrine sweat glands, malaria occurs. If there is blockage in the duct of apocrine sweat glands, Fox-Fordyce disease occurs. Okay. Now this malaria can be divided into various types depending on level of blockage. Like malaria crystallina, it is due to blockage at the level of stratum corneum. Malaria rubra, it is due to blockage at the level of Malpighian layer. I already told you what is Malpighian layer. It is lower epidermis, that is stratum spinosum along with the stratum basale is known as Malpighian layer. And malaria profunda due to blockage at the level of dermoepidermal junction. So depending on the level of blockage, these are different types like crystallina, rubra and profunda. Among them, rubra is most common. It is so common that almost all of you might have suffered from this. This is commonly known as prickly heat. Okay. While Fox-Fordyce disease is due to blockage in the duct of apocrine sweat glands, and apocrine sweat glands are commonly present over axilla. So axilla is the most common site here. Over axilla, itchy papules develop. So due to blockage, these itchy papules develop, and this condition is common in females in their second decade. So these are the points to remember about Fox-Fordyce disease. Over the axilla of these females in their second decade, they might develop these itchy papules. This is the presentation of Fox-Fordyce disease.